Then with the help of a domestic yoga prop like a rope, the loop is already formed with this knot. This rope we are using for the shoulder retroversion, and it specifically helps to have the passive retroversion. This is not active retroversion. This is not a movement. It's a static and passive stretch. First, I will hook this rope to a handle or a window bar. After hooking this rope, this loop is formed. I will ask the person to stand, taking back towards this rope, and I will ask him to take his right hand and put it, and then left hand put it in the rope at elbow level, at the elbow level. Then I will ask him to keep some distance between the legs. Then flex the elbows a little so that he can place his palms on his side abdomen or abdomen. It gives effect on the upper back, shoulder region, neck region. The face or the chin should not be peeping out. It is normal in the position. The middle back, that is the part between two scapulae, is relaxing. It's relaxed in this pose because rhomboids are relaxed, because the trapezius muscle is also relaxed. Here maximum stretch is felt in the pectoral side, front side, and shoulder joint area. If the person leans down in the front, then he can feel the tension from the rope, and the rope pulls his arms behind a little bit. It's a gentle stretching. Slowly he can increase the stretching level or the tension on the rope, but always the rope should be tensed enough to pull the elbows backward. It will lead to pulling the shoulders or rotating the shoulders behind, and it will at the end, and in the front side, the pectoralis muscle, which is the pocket muscle, which is also called as pocket muscle, it is also getting stretched from sternum towards shoulder joint, and that is the main effect of this posture. It gives the awareness how to keep the shoulders behind always, and that memory is stored again in the muscles. Now you can slowly come back a little bit towards the hooked rope, and then remove the rope like a jacket from hands, relax, and now we will see some therapeutic postures regarding lumbosacral region and thoracolumbar region. The lumbosacral region is covered with a very much complex musculatures which are culprit because of the overcontraction and chronic contraction. Sometimes one-sided muscles are contracted, sometimes both side muscles are contracted. So to rearrange them, to give some space for them, is the best way with the help of rope. Always in a yoga posture, the yoga teacher tells to rotate the pelvis, to straighten the lower back. That means not to exaggerate the lumbar lordosis. The lumbar curvature should be natural. But if it is more than the natural curvature, if it is exaggerated, then the person feels back pain, lower back pain. It may radiate to the legs also sometimes. I will use a simple rope with a knot, and that knot makes a loop of that rope. This rope I will tie to the person at the waist line. This is the waist where the pants fit. Take the rope around the waist, turn in the front side please. From the front, it should be placed below the lower abdomen. near pubic area. And from the back side, just turn around. From the back side, the knot is to be adjusted at the sacral level, where the sacrum is there. Now I will lock this loop with the help of this knot and prepare a sacrum outside the body. This looks exactly like a sacrum outside the body. On the sides, the rope should rest on the iliac crest, where our pants fit. This is the point of iliac crest, so that the rope becomes fixed here. And here a tail is formed to hook other belt in this loop. This single purple belt, I will hook it in this tail. The open end of the belt is locked. Try to take the distance of the belt just 3 to 4 inches above the heel. Here is the heel. So approximately 3 to 4 inches above the heel, so that when I pull it down, it should give stretch to the lower back and pelvis. I will request him to have the support in front of the chair. The therapist is supposed to anchor the arch of the foot in that belt loop. Here, if you look at the foot from here, the belt is tensed. Once the belt is tensed, the rope is going to pull it down, pull the lower back region muscles down. So the person has to find his balance. The patient has to find his balance. So I will request him to keep some distance between the legs. Yes. And then I will slowly pull it down, pull the belt down. While pulling it down, you can see the movement here. Again I will show there is a movement while pulling it down. While pulling down, it is the pelvic structures are getting stretched downward. This is a movement happening. The anchoring, fixation is at the thoracolumbar area, and the stretch is felt in the lumbar musculature. Always for a movement or stretching, there is an anchoring point and there is a moving pivot. So here anchoring point is here. The patient himself held himself from here, and the lower back structures are moving downward, stretching, getting stretched downward. I am keeping this belt stretched downward for longer time, like 20 seconds, 30 seconds, for a minute also. And then I will slowly release it, not with a jerk. I will slowly release it, so that again the muscles around the lumbar region will come back to the normal position. But the memory of stretch is registered in the musculature. The main musculature which is stretched is latissimus dorsi, which is the wing muscle. Then secondly, the hip joint, gluteal upper fibers. Then the deeper structure, deeper muscle, which is called as QL, quadratus lumborum. And the oblique muscles, which are present from laterals to the medial side of the lumbar region, which cover the laterals. These are called as oblique muscle fibers. Those muscle fibers also get stretched. But mainly, the effect is seen on the quadratus lumborum, which is a deeper muscle, and that gets stretched. So the pain in the lumbar region, sacral region, and the hip region is reduced. I will again show it how to stretch it down, keep it for half a minute or 1 minute, and then slowly release it, not with a jerk. After a few days, we can tell the patient to hook this belt in his arch of foot. Yes. Take it down and touch your heel down, keeping some distance between the legs. Keeping some distance between the legs. Yes. Press it down and touch your heel down so that he can just press it down and keep it down only. There is no need of pumping. Just stretch it down and feel the stretch. From here, the rope is pulling the muscles. From here, the belt is pulling the rope. Now, while removing, I will ask him to bend the leg. Yes. While removing this belt, I have to unlock this belt, take it out, and then we can unlock this rope also. Relax. Thank you. For the patients who have some disturbances or problems in the standing stretching positions, the same stretch we can have, the patient can do in the lying down pose, especially in the acute condition like sciatic acute pain or the acute lumbosacral pain. Those patients can lie down and do the same stretching. I will fit this rope on the waist line. Just turn back to me. Just like a tailor, we have to take the measurement of the waistline and then fix or lock this rope. Turn back to this side a little, as before. Now here already took that wallet out of the pocket, but specifically we need to tell the person, don't keep anything in the back pockets or front pockets, because that obstructs the stretch. After locking the other belt, I will see the distance or the length of the belt, how much it should be. It should be around 3 to 4 inches from heel. And from the front, make sure that the rope is below lower abdomen, near pubic area. From the sides, it is on the iliac crest. Now I will ask him to lay down, legs to this side, head to that side. Always lay down on one side first, left side first, and then turn on your back. This loop I will take from between the legs to adjust the distance. First, I will equalize the distance, take a similar distance like legs of the belt. Then I will tell him to fold his right knee, bend the right knee, and hook his heel in this loop. From heel, I can take it on the arch and slowly straighten your leg. By straightening the leg, there will be a tightening around the waist of the rope. If the person is not feeling that tightening of the waist at the waistline, then he can fold his both knees a little bit, lift the back up. I can pull the belt down, keep it pulled, and then again I will ask him to hook his foot in this belt and stretch it down. Yes. Now straighten this leg also. What it does is the pelvis, whole pelvis is turned in front, which is called as anti-version of the pelvis. It happens easily with this stretch. And the person's back muscles, leg muscles are resting. There is no pressure or no action. The muscles are not doing any actions. Zero pressure is there on the muscles. Thank you. The next position is therapeutic pose called as Shashankasana. Shashankasana is a classical pose which resembles a rabbit. So it's in English it's called as a rabbit pose, in which we will use a belt to keep the pose in a balanced way. First, I will ask the patient to sit down on the heels. That is Vajrasana, sitting in the Vajrasana. Sit down, face towards this side. Just sit down and keep yourself straight like this. Sit straight. I will fit this belt which has two buckles. One is for not allowing the unlocking. This belt is fixed on the waistline, and then I will tighten it. So I have prepared another waistline from outside, and then I will request him to keep his palms in front on the floor and slowly go ahead, touching the abdomen to the thighs if possible. Now when there is a contraction of the lower back region muscles and the upper hip muscles, then the body doesn't allow, those muscles doesn't allow the sitting bone or ischial tuberosity of the hip touching down to the heel. It doesn't allow that. So our aim is to bring it down after few days or after few sessions of the yoga therapy. For that, I will help him with this belt. I will pull it back so that I need not press it down. If it is pressed down, then some patients may have pain. So, sitting behind him, I will help him by holding the waist and pulling it down for 5 seconds, and then I will release it. Again, pressing it down, so you can see the movement. The ischial tuberosities are coming near and near to the heel bone. Then relax. Slowly you can come back to the sitting pose with a straight back. Whatever pressure was there on the lumbar region or thoracolumbar muscles, that spasm, that contraction gets released by this simple pose. But only contraindication for this position is knee joint osteoarthritis. The people who can't fold their knees like this, sitting in the Vajrasana, those people cannot sit like this, so they can't perform this posture in the sitting pose like this. They can use the previous two postures with the rope and belt, and that's all for them. Because the osteoarthritis, especially related to the patellofemoral arthritis, this posture is contraindicated in such cases. Otherwise, this helps a lot to release the strain on the lower back muscles. Thank you.
So, my dear friends, we are at the end point of this video cassette. As you have seen, there are a lot of techniques that Dr.Shirish Deshpande has explained to you. I would like to thank at this particular moment to my other colleagues. Actually, you have already introduced Dr. Shirish Deshpande, who was a yoga expert, and he has got a training from renowned international personality in Pune, Dr. Karandikar as well as Dr. B.K. Iyengar. So I thank Dr. Shirish Deshpande for sharing his skillful experiences with us. He is also taking a lot of seminars and workshops regarding his manipulative techniques for the problems. And in Pune he is very famous, and now he is also very much famous in the foreign countries like Spain, he's nearly visited 7 times to the health center Port Saluki. And at this moment, here we are having the introduction with my other colleagues who have already participated in this video cassette as a volunteers, but you must be very familiar with these doctors. Dr. Sachin Sarpotdar, please Dr. Sachin Sarpotdar, he is from Talegaon and he is practicing Ayurveda and Panchakarma and Yoga in his clinic since last 15 years. He is an excellent physician, renowned physician in the Pune, but of course he has shared his experiences and knowledge throughout the world. He has moved from America to Switzerland, then Germany, and of course he has visited to our center, Port Saluki, nearly 5-6 times. He is very famous for his skills of oratory. He is a good seminar giving person, and also he has written a lot of books with me like research methodology. He is expert in Ayurvedic researches, but basically he has a roaring practice of Ayurveda with treating a lot of complicated cases like for example heart diseases, then arthritic problems, then diabetes mellitus, and a lot of so-called the given up cases from the allopathic fraternity. So I thank Dr. Sachin Sarpotdar.
Thank you, sir.
And here on the right side, meet my friend Dr. Shinde. He is also a postgraduate in MD, that is a Doctor of Medicine, in the subject of pharmacology. He has done his pharmacology in the Bharati Vidyapith's Medical School of Ayurveda, and his own practice, Ayurvedic practice of course, at very near to the Nigri Pradhikaran area in the Yamunanagar sector. He has a specialty of preparation of medicines of high quality, like practicing GMP, good medical practice, or what you call it is a good manufacturing practices, GMP norms. He has his own product range starting from the Chyawanprash, which is very universal tonic of Ayurveda, up to the single herbal medicines. We all the time discuss a lot of formulations together, and he accordingly prepares a lot of herbal minerals and ghees, medicated oils, and we are very glad that we are selling these medicines to the foreign delegates who are coming over here or where we are visiting to the foreign countries. And each and everybody is very happy with the quality of these medicines. And nevertheless qualities, but he has interesting packings also, or the packing style, what you can say. Very decent, very sterile packings, and his medicines are used by the different Vaidyas also in from Pune. So I thank Dr. Sachin to participate in this as a volunteer in this session of manipulation techniques. Now at the last, I will request Dr. Sachin Sarpotdar to make a concluding comments on where we can use these manipulative techniques for the problems of upper back and lower back. Dr. Sachin, please.
Thank you, sir. In our last 15 years of medical practice, we have observed that 70 to 80% of the patients who are seeking the medical treatment from Ayurvedic physicians are suffering from the different musculoskeletal ailments, especially the cervical spondylosis or early degenerative changes in the cervical spine, and at the same time the lumbosacral disorders, especially the lumbar lordosis or the degenerative changes in the spine in the lumbar region. And with the help of Ayurvedic traditional Panchakarma therapies, they are getting benefited. But if we add these manipulating techniques along with Panchakarma therapies, I hope the majority of the patients will appreciate our manipulating techniques, and the worldwide propagation of these techniques will have the tremendous scope. So I give my best wishes for the patients who are suffering from the cervical problems and the lumbar problems, and I hope these manipulating techniques will be beneficial for them in future. Thank you.